The manhunt is over. All of the victims have been identified, and now the people of Lewiston, Maine are beginning to pick up the pieces after a gunman murdered 18 people in a bar and bowling alley last week in the deadliest mass shooting in the U.S. so far this year. As families and friends begin to bury their loved ones who range from 76 to 14 years old, police, public officials, and advocates are taking a look at what led up to this shooting and what could have been done to prevent it, and reported mental health struggles of the suspected gunman and Army reservist have come into play here. The suspect, who we're choosing not to name, was sent to the hospital for a couple of weeks of inpatient psychiatric treatment after he made alarming statements about his Army Reserve unit. That's according to the Washington Post, who also reported that the gunman had described hearing voices in recent months. So what do these insights mean for preventing future massacres? And what about the vast majorities of Americans who suffer from mental illness who pose no threat of violence? Well, to help us break all of this down, and we know it's a complicated subject, is Susan Lewis, a clinical and forensic psychologist, attorney, and author. Susan, thank you so much for joining us.
My pleasure.
So you've been doing this work, and as you saw what played out in Lewiston, what went through your mind?
Well, it was horrible. No question about it. I think that some of the theories that they began with in terms of this individual having a mental illness may have been mistaken. Mental illness is kind of a catch-all. It's kind of like cancer. But mental illness is really something that's very specific. The individual that was involved in the shooting, I believe, was in his 40s. There was some conversation that he was hearing voices and that he had been hospitalized. And the reality is, at that particular age, it's very unusual for someone to have a psychotic break, which is when someone would hear voices, unless there's something going on in terms of his brain or something like that. So I think that the media has been looking very hard, as it always does, to try and figure out why an individual would do something like that. And of course, the end is always that there's a mental illness.
Well, we know that, his family thought that something was going on. They reported that he had been hearing voices, had some paranoid behavior. They apparently reported it to the police and to this Army Reserve unit and felt like not much was being done there. There was a conversation around whether or not he actually had treatment this past summer. There's some conflict, where we had, contradictory reports on that specifically. So if it wasn't this mental illness piece, and you mentioned that oftentimes these things get mischaracterized, what is it normally in your experience? And of course, you obviously don't have access to this man's medical records. We understand that.
That's true. I think that mental illness has become a catch-all phrase. And it is really something that's very specific. And severe and persistent mental illness is based on a particular diagnostic and statistical manual. And so to say that he was hearing voices and that people were concerned about him, there's no question that that's alarming. On the other hand, that's not necessarily anything predictive of the violence that we have seen most recently. It is not uncommon for individuals to seek out mental health care, and the system really is set up at this time not to be able to meet the demands that are necessary of individuals that suffer from mental illness. And often what happens is, particularly in hospitals, people get held for 72 hours and discharged afterwards. There isn't any place for people that are mentally ill, and they get discharged to the street. Doesn't sound like that was the case with this gentleman, but clearly there was something going on, and he needed some kind of treatment that probably was for an extended period of time, and that was not available or it wasn't given to him, which is a tragedy.
We see the profile of these gunmen and the gunmen in the mass shootings that we've seen in the last few years, and it seems like it's a white male. There's some sort of background that means he's isolated. As you think about this as an attorney, as someone who's also a psychologist and has written about this topic, I mean, when you are profiling these folks, is it the person, or is it the guns? Because oftentimes the conversation is around this person has the archetype for a mass shooting, and so therefore mass shootings occur, and it's not necessarily the gun. Do you think that's conflated in this conversation?
Well, I think that there are many people that have grown up in environments that are not conducive to having healthy lifestyles. Childhood sexual abuse, beatings, poverty. These individuals don't have a pillow to put their heads on and feel safe. Many of them do not become mass murderers, which I think is really important. And so I think that we can't characterize these individuals and say, well, an individual that grows up in this kind of an environment has a propensity to be a mass killer. On the other hand, the guns that some of these individuals use are guns that are made for warfare. And I suspect, I don't know that this is true, but one of the reasons there was some difficulty in identifying the individuals was because the gun that this gentleman used was designed for war and to essentially destroy someone's being, which I believe it did. So I do believe that this level of use of guns, at least these guns, are out of control. They're not guns that should be sold on the market or anywhere else. They are used for warfare, period.
I'm always struck when we have these conversations and it is framed as someone who had a mental illness, whether that's true or not, that then there's not more resources put into mental health care, which seems like that's where we see the deficit, whether or not someone gets a sniper style rifle and decides to kill 18 people.
Whether or not there is money in mental health care, I think the stigma of mental illness is nothing new. I think it's been around for hundreds and hundreds of years. Many of the patients that I've seen that are very, very ill are very ashamed that they have a diagnosis and that they have been referred to as mentally ill. And so there's a stigma attached to it. There's a stigma attached for individuals that want to be in individual therapy. You can imagine the stigma attached to someone that needs hospitalization. There are no long-term hospitals anymore. There's nothing in the community to help people. There's nothing in the United States that I know of that has been designed to really deal with those individuals who are really suffering over the long term from severe and persistent mental illness. It's a terrible, terrible tragedy.
That's for sure. And as we think of the folks in the town of Lewiston and how a community can recover, what kind of supports need to be put in place so that folks can feel some type of normalcy, whether that's next week or a year from now?
That's a wonderful question. We hear the politicians saying that the community will draw together and they will support each other. I hope that that's true, but I wouldn't be surprised if the majority of people in Lewiston, Maine are suffering from post-traumatic stress disorder. And it would make some sense to bring in some mental health professionals to assist them with that. It's very difficult for them to heal on their own, and there are going to be long-term consequences for this, as there were in Sandy Hook, and there have been with their other mass shootings. It just doesn't go away because there's a community of people that draw together, although that's certainly important. I don't think it's the most important. I think people's mental health is.
Yeah, I think about that, there was a playhouse there. There was, of course, the kids going to school and the community coming together. Do you think that what it is like maybe the federal government needs to step in and have these people at least provide funds for access to mental health clinicians, because we know that that's already a challenge.
That would be simply wonderful. Although we know the federal government doesn't move at lightning speed.
That's certainly right, especially when they're trying to get a House Speaker elected. Not to put light on this, but the other thought I also had is when you mentioned Sandy Hook, I've met so many Sandy Hook families and other folks who have experienced this type of traumatic event. If you were there, what advice would you give them?
If I were there, what advice would I give the survivors?
The survivors, yes.
Yeah. Well, I would encourage them to get mental health care. I probably would encourage them I think that group therapy can be very helpful. I would encourage them to share their feelings with each other and not be fooled by the politicians that say, oh, everything will be all right. Just draw together at a community, that there's really a focus on assistance by the professionals that are trained to give it. That's what I would suggest.
Well, Susan Lewis, certainly that's so important right now. Thank you so much for your time.
Thank you.